can we hear from some people about what they've heard today that's resonated so far? And you can raise your hand and we'll call on you, or work on the Jamboard, either way, or add to the chat. Does anyone have feedback? Deborah, did you want to speak?
I do, thank you. I wanted to just say that what resonated with me most this morning is the commitment from such a wide group of people to make a difference. I think it's really, really inspiring and impressive to me. There you go.
Thank you. And can someone, Stuart, can you add that as a sticky note?
Yes,
please?
I will.
Thank you. Who else would like to share? Or stick a sticky on, or put something in chat.
Hi,
and if
I'm
you're ready,
Esther.
feel free to take over. Hi,
I'm
Esther.
from San Francisco. So I was actually really surprised, and I guess I shouldn't be, but it was wonderful to hear how everybody is kind of in the same boat. You know, we're all human, we have families, you know, we're working, and to juggle everything together. I think that was one thing that was really nice to feel like you're not by yourself.
Very good point. Very good point. Uche, are you able to take over at this point?
Yes, I am. Thanks.
Okay, thank you.
Yeah, let's hear from folks that haven't commented yet. Edmond, would you like to chime in? Okay, it doesn't appear that what about Dario Santiago? Some comments?
Morning, everyone.
Morning.
Yeah, I just you know, it was great seeing so many counties coming together to, you know, share the same issues and make commitments, you know, to support our aged and or disabled populations. I'm the executive director for the Public Authority in Marin, and we are the, you know, the employer of record for bargaining purposes here in Marin County for the IHSS social providers. But you know, as the supervisors mentioned, you know, that we depend on the county to you know, certify funding for the caregivers, and you know, and that also depends on how much the state provides and how much you know, funding comes from, you know, trickles down from state and federal. So it's a really it was great to see that conversation, and they really provided some hope, I think, for the future of you know, the people that want to provide care as a profession. So those are my comments.
Thank you. That was great. Appreciate that, Dario. Anybody else would like to chime in? And what are your thoughts? What did you hear that resonate to you?
This is Monique Parrish. I put a sticky on your Jamboard. What I took for this, I'm working on a healthcare and social service consultant and also a clinical social worker. And what I was struck by was this need to look internally for counties, like where are the synergies and partnerships and collaborations, whether it's with the departments of public health, whether it's, and that could be sort of to promote both education and data collection, but also at the same time putting that pressure on those state and federal partnerships and making sure that the matches that we have on behalf of direct care workers are adequate. But it's really not a single source solution. It's really going to be sort of being creative and putting pressure on all spheres.
That was good. Often when we deal with issues, we don't look internally to see what we have and how we can actually use our resources internally to address the issue. That was a great point.
Absolutely.
Yeah, that was a great point. Anybody else want to chime in before we go to the next question?
Uche, there's some really great stickies too.
Oh, would you read it? I can't see it.
Yeah, I can share one.
So There's several of them that are really great. It was really, let's see, providers, paid and unpaid, deserve a living wage. Commitment by the elected officials. We are not alone. Appreciated uplifting the need for advocacy at all levels and holding those in leadership accountable. We depend on the county for funding. There is support for care providers. That counties need to explore solutions using county resources, but also advocate for state and federal solutions and funding. The lessons learned from COVID. I appreciated the creative thinking and the different ways counties worked to meet the needs, new or exacerbated. Working with various agencies to provide support and resources for the growing aging population. Did I miss any?
Yeah, these are all great. This is, I mean, this is why we're having this conversation, right? At the end of the day, I serve on the workforce board. I've been on that board for about 10 years now. So, one of the areas that we tend to see struggles is in this area where people are not paid, but they do a lot of the work they do is so immeasurable and appreciated. And we talk about funding and on a state level and county level. We don't. This is my experience. We don't advocate for this the way we should be advocating. Because that's at the end of the day, it helps the county leaders to make decisions when we are out there knocking on their doors and knocking it down. Keep engaging them in ways that they will understand that we need more funding in this area. That was really great. So I appreciate it.
And Uche, do you have access to the second question that's in the chat right now?
Yeah. So the second question is the second question to the to this discussion, right? Right. So what action will you commit to do to elevate these issues? And what suggestions do you have to make this happen? So what actions would you commit to? And what suggestions do you have to make this happen? This can come from things that you've had today, including what's missing, or from other places. So that is it's a lot of things to kind of unfold in that question. So let's start with one. What would you commit to elevate this issue? What are your commitments?
I can go if that's okay. I'll
Sure.
lower my hand. My name's Dodi Zotai, she, her pronouns. I'm the director of the healthcare career pathway at Empowered Aging. I get to work with Susanna, which is awesome. I think one of the things that I would say, elevating the work that's already being done and some of the model programs that are working, to continue funding those. So for example, our healthcare career pathway, it's supporting specifically students with addressable barriers get into the direct care workforce and starting off with CNA training. But I know other folks are doing work around community health workers, IHSS, giving folks the supportive services so that they can actually access education and get into healthcare, and then providing them additional supports afterwards. And so I think having that piece in education, one thing I would say that probably hasn't been tapped into as much as it should be as a previous adult school educator, is community colleges get a good bit of funding, and focus on funding community colleges, which needs to happen. And I think we need to look at also funding adult education, adult schools, right, that are attached to K-12 with specific funding as well. So we have specific funding that goes to community colleges for like CNA training, for example, but we don't have from the state level or sometimes even local levels going to the adult schools, which are more nimble actually in starting programs and launching them, and have a lot of times more supports in place for their student population, just because of the nature of how adult schools work.
All right. Great points. Anyone else? Consuelo, would you like to chime in? Can you
I'm
hear
sorry, were
me?
you asking me?
Yes.
I can certainly look at some other stickies that are here. Working with, let's see, various agencies to support resources for growing age population, elevating the work that is already being done and highlight models that are working, supporting students to get into the support work, resources for a direct care workforce. Let's see, I'd like to see all of us commit to advocating for similar legislation to the fast food bill, AB 257, which now got moved. Where did it go? When I was reading the fast food bill, which supports living wages and solid, good, strong working conditions for fast food workers, but to do something like that for the direct care workforce. Funding for higher education and making it more accessible for individuals, especially those who do not have the experience or background in this field. Let's see. And then there's some comments about funding and funding for schools and for programs.
Yeah, I mean, obviously funding is a big issue. Whether it's on a state, federal, local level, it comes down to the people that make the most noise, tend to get the attention of the legislature. So that's really an area that we all need to be involved in, is advocacy and constantly meeting with our folks. Esther, would you like?
Hi, this is Esther. So I do think the funding is very important. I do think another aspect that needs to be looked at is, so as somebody who provides direct service, I see some of the caregivers, I'm a caregiver myself, but I do see that there's a missing piece of the quality of caregiving. To make sure the person shows up, to make sure that they're meeting the needs that the client needs. Specifically, to each person, not that they're just showing up and just being there. I do think that there needs to be more specific and more oversight into the quality of care that's provided from the caregivers. Whether it's a case manager that steps in more often, or just a quality assurance aspect of the caregiving that's provided.
So when you say oversight, I think we all struggle with the issue of oversight, because it's not consistent. It's across counties, and you hear, even in the nursing home, you hear some of the complaints coming from there. But when you say oversight, is it from the county side or as a statewide issue?
Well, I mean, I see that Homebridge, for example, is a program. IHSS is a program, and they do have case managers, but they have so many people that they so many cases that they oversee, that pretty much all they're doing is making sure that the person, signs off on their timesheet and things like that. But the quality of the work, you know what I mean? Are they doing specifically what the person who needs the caregiving, are they doing specifically what they need? Again, as somebody who kind of sees, I guess, both sides, I see many caregivers who come and it's the minimal amount of work that's provided. A lot of times it's family that the client hires, and this money is not being paid for watching a movie, it should be more tailored specifically to the client and their needs. Are they able to eat this type of food? Is it the consistency that they need? Do they need to shower? There needs to be more oversight that it's meeting the needs of the person who has hired them.
All right. Yeah, well said. Thanks for that. Deborah, am I saying it right? You wanna some comments? You need to unmute.
I think I was shaking my head vigorously in support of what Esther was saying.
Okay.
Thank you, Esther.
Thank you, Esther. Any more thoughts before we wind this down from anyone?
I have a comment. I just have one comment. I just want to challenge everyone to speak with your elected representatives, the board of supervisors. They only know about these issues, two ways. One, if they go through it, in their personal lives, like many of the supervisors shared, or when people like us, share the stories about what's going on in the workforce, or, what's going on with the caregivers, or with family members that are struggling to find a caregiver. So that's really, the commitment that I've made for myself. And I just, ask that, that's something that we should all be doing.
Yeah, absolutely. You can't overdo advocacy. You have to keep doing it. It's an ongoing process. It's an ongoing kind of requirement that you do, and then the outcome shows when people advocate in a consistent way. So this has been an amazing conversation altogether. I think we will be going back to the general group soon.